video, I will discuss you the Module 15, which is Development of an OS Program. In this module, it will help you to design your own OSH program specific to the unique condition and situation of your company. OSH Policy. Before you can design your company's safety and health program, foremost is the necessity to ascertain your company's C&H policy. What is your company commitment on safety and health? Do you have the strong leadership and necessary mechanism to implement this? Firstly, let us define what a policy is. Policy as a plan of course of action as a government, political party, or business intended to influence and determine decision, action, and other matters. A safety and health policy is a document stating the top management safety objectives, the level of safety and that can be performed by the organization, and the responsibility of the organization members for executing the policy and ensuring safety. Characteristic of an OSH policy. An OSH policy is characterized by the following: specific to the organization, concise, clearly written, date and sign, indicates management commitment, support, and accountability, includes principle and objective of protecting SH of all members of the organization, states compliance with OSHS and relate law, state objective to continually improve the OSHMS. Employees are aware of the policy, communicate or post. Covers all workers and community. Safety and health program defined. A safety and health program is a plan or outline of activities conducted to promote safety and health consciousness among management and workers in order that accidents and illnesses can be eliminated or minimized to the lowest reducible level. The effective management of worker safety and health program. Reduce the extent and severity of work-related injuries and illness. Dapat na magsama-sama ang mga empleyado sa pagpapatupad ng mga hakbang sa pagkontrol na mabawasan ang mga aksidente at sakit sa lugar na pinagtatrabahuhan. Kung ang mga ito ay magpapatagbo ng maayos, ang mga kaso ng aksidente at sakit ay mababawasan. Improves employee morale and productivity. Kung ikaw ay nagtatrabaho sa isang kumpanya na pinaghahalagahan ang iyong pangkahalatang kabutihan na nagbibigay sa iyo ng seguridad at kapayapaan, ito ay magbibigay sa iyo ng higit na pagiging produktibo at kasayan sa iyong pagtatrabaho. Reduce workers' compensation cost. Kung ang mga aksidente at karamdaman ay naiiwasan, mababawasan nito ang mga gastusin para sa pagbabayad ng kompensasyon ng manggagawa. Safety and health program criteria. Workplace specific. Must have commitment from the employer and senior management. Must have input from the workers. Must assign clear responsibilities and accountabilities. Each of the program's elements must be in writing. Must address the safety and health of contractors. Be available and effectively communicated. Must have an evaluation mechanism. Safety and Health Committee. The Safety and Health Committee is the planning and policy-making group of the company in matters relating to safety and health. This is composed of employer and employee representatives such as the following: CEO, manager or his representative, workers representatives, union member if organized, company physician, nurse or first aider, safety officer. Function of the Safety and Health Committee. Being the focal group on workplace safety and health, the function of the committee includes plans and develop accident prevention programs for the establishment, direct the accident prevention programs of the establishment, Conducts safety and health meetings at least once a month. Reviews report of inspection, accident investigation, and implementation of programs. Initiates and supervises safety training. Develops and maintains disaster contingency plans. Components of an OSH policy. The OSH policy can now be translated into various program interventions. It should cover a holistic approach and package of programs and activities. The OSHC adopts a framework in defining the components of an OSH policy. The OSH policy frameworks identify the following components: safety, control, and emergency preparedness. Examples of these are programs relating to housekeeping, material handling and storage, electrical safety, machine guarding, personal protective equipment, fire safety orientation and exit drills, maintenance of firefighting facilities. The emergency preparedness encompasses all activities that are necessary to prepare people and organizations to respond to emergency and disaster, which include typhoons, floods, industrial fire, chemical leaks, earthquakes, and oil spills, among others. Therefore, proper planning for emergency is necessary to minimize employee injury and property damage. This includes areas in declaring an emergency, evacuating workers, obtaining entertain emergency resources, obtaining help from external resources, initiating emergency rescues, tending to casualties. There are elements of an emergency preparedness program that should be considered, namely: review the hazards, evaluate resources, develop emergency plan and procedure, conduct training, conduct drills and exercise, educate public, integrate in community plan. Industrial hygiene program. This includes program of the company that covers inventory of chemicals, emergency contingency plan, capability building program for chemical users, materials handling and storage procedures, abatement of physical hazards. Occupational health program. This includes programs on employment or hiring of medical staff, availability of clinical, dental, and medical equipment, preparation and submission of annual medical report, compilation of medical records of employees including analysis of the data, HMO or in-house health services or both, medical services and other programs implemented. Environmental protection and community relations. Aside from safety and health, the company program should also cover the following: data on classification and volume of waste generated, pollution prevention facilities, wastewater treatment, employment of a pollution control officer, list of outreach programs and description. Social accountability programs. These programs take into account the involvement of the company on issues such as policy on gender, policy on child labor, policy on WDS, other corporate social responsibility programs. Capability building on OSH. This involves compliance by the company to mandate specialized OSH training course and conduct of activities to promote OSS. This includes list of required orientation training on OSH provide Bosh, CST, drugs, HIV, AIDS, gender, anti-sexual harassment, family welfare, OSHMS, and others. Training calendar of the company, other staff development activities, plans on communicating OSS, information program, materials and dissemination strategies, monitoring and evaluation. Monitoring. It is necessary for any organization to monitor and evaluate the effectiveness of all its safety and health policies and programs. In doing this, the company will be able to improve the performance of the program, know if change or revision improvements are necessary, check areas that have to be prioritized, assess program effectiveness. Number of accidents and injuries are trending downward. Cost of accident and injuries is trending downward. Time lost due to work-related injuries or illnesses is reduced. The greatest responsibility a person can have during his lifetime is to be accountable for another person's safety and health, and for the protection of the environment. That's all. Thank you for listening.